What is Cibinqo? Cibinqo is a prescription medicine that is a Janus kinase inhibitor. Cibinqo is used to treat adults with moderate to severe atopic dermatitis, eczema, that did not respond to other treatment that is not well controlled with prescription therapies, including biologic medicines or in adults who cannot tolerate these therapies. During the first 3 months of treatment with Cibinqo, do not take Cibinqo with other medicines that prevents blood clots. You can take low-dose aspirin up to a dose of 81 mg each day during the time if prescribed by your healthcare provider. Dosing information. The recommended dosage of Cibinqo is 100 mg orally once daily. If an adequate response is not achieved with Cibinqo 100 mg orally daily after 12 weeks, consider increasing dosage to 200 mg orally once daily. Discontinue therapy if inadequate response is seen after dosage increase to 200 mg once daily. Cibinqo can be used with or without topical corticosteroids. If a dose is missed, administer the dose as soon as possible unless it is less than 12 hours before the next dose, in which case skip the missed dose. Thereafter, resume dosing at the regular scheduled time. How should I take Cibinqo? Take Cibinqo exactly as your healthcare provider tells you to take it. Take Cibinqo 1 time each day, at about the same time each day. Swallow Cibinqo tablets whole with water. Do not split, crush or chew the tablets. You can take the tablets with or without food. Cibinqo can be used with or without prescribed topical medicines for atopic dermatitis. Prescribed topical medicines are lotions, creams, or ointments applied to your skin. If you miss a dose, take the dose as soon as possible. If it is less than 12 hours before the next dose, skip the dose. Take the next dose at your usually scheduled time. Before taking Cibinqo. Before you start treatment, tell your healthcare provider about all of your medicine conditions, including if you have an infection, are a current or past smoker, have had a heart attack, other heart problems or stroke, have kidney problems or liver problems, have low platelet counts or white blood cell counts, have any eye problems, including cataracts or retinal detachment, have recently received or are scheduled to receive an immunization vaccine. People who take Cibinqo should not receive live vaccines, are pregnant or plan to become pregnant. It is not known if Cibinqo will harm your unborn baby. Cibinqo side effects. The most common side effects include common cold, nausea, headache, herpes simplex including cold sores, increased blood level of creatinine phosphokinase, dizziness, urinary tract infection, tiredness, acne, vomiting, mouth and throat pain, flu, stomach flu, bacterial skin infection, impetigo, high blood pressure, allergic skin rash to something you came into contact with, stomach area pain, shingles, low platelet count.